The next is child with fever. Okay, child with fever. Okay, and then develop red rash and face. Okay, it is rosy. It is roseola. Roseola, you will have first fever, then rash. It is also called erythema infectiosum, fifth disease, slapstick rash. So you will remember if you are fetus, you will have Ross fetalis. In can say in child you will have slapstick rash. In adults, you will have rheumatoid like arthritis, but it will be you can say self-limiting. In patient with history of hereditary spherocytosis, then sickle cell disease, thalassemia, you will have aplastic crisis. Then 3C mnemonic for measles, cough, conjunctivitis, chorea, and cough-like spot. That is measles. It is given in cough-like spot. Irregular red spot are given, okay, with given in the molars. Yeah, near to molar. It is blue-white. Okay. Then is turn bounding pulses, high pulse pressure, diastolic murmur, head bobbing. Remember for aortic regurgitation, whenever question will be given, systolic blood pressure will be high, okay, like 180, and your diastolic pressure will be decreased, like it will be 50. Above will increase, below will decrease. This is called wide pulse pressure. And you will have like volume overload like condition. Pulses will be high. Pulsing, you will have feel pulse under the nail bed, pulse feel in the vagina, pulse will feel in the head, like that. It is diastolic heart murmur. And aortic stenosis, you will have ejection murmur, crescendo, decrescendo murmur. Pulse will be narrowed, because you will have pulses parvus, tardus, delayed peak of pulse, and weak pulse. What is aortic stenosis? Because cardiac output will decrease, stroke volume will decrease, and continuous. In roseola, you will have just fever and a rash. In parvovirus, okay, where is the parvovirus? In parvovirus, you will have different type of finding. Okay, in parvovirus, so typical rash will be given on face, like slab cheek rash. Typical, if it's given. It's so easy. In roseola, you will have diffuse rash in your body. Okay, continuous murmur is PDA. Okay, PDA will give you a machine-like continuous murmur. Okay, so easy. Chest pain on exertion in angina, stable if it with moderate exertion, unstable with minimal exertion at rest. Okay, stable angina, unstable angina. So easy. Chest pain with ST depression on SG, ECG. Okay, if a marker are negative, it is angina. Remember, in angina, there's no infarction, there's no necrosis of cardiac cell. But if a troponin in a positive, that is end-stem. Okay, then is the done. Okay, then is the chest pain, pericardial effusion, friction rub, that is triphasic rub, and chest pain that relieved after leaning forward, that persistent fever after MI, and you have diffuse ST elevation in all leads. That is you can see it can be if it can be Dressler syndrome. It can occur after months after MI. Okay, it can also be acute pericarditis. If it occur right after MI, it can be Dressler syndrome. It can be post MI pericarditis. Then is a back triad, a cardiac tamponade, distant heart sound, muffled heart sound. Okay, distended neck vein, hypotension. Okay, it is diastolic heart failure. Right heart failure is common. I mean, Right heart failure is common in cardiac tamponade. Painful, ouchy, okay, raised red lesion on pad of finger and toes. So ulcer nodes are ouchy. It is infected with endocarditis that are immune complex deposition. Painless erythematous lesion on palm and sole that are genuine lesion is due to septic embolism. Simpleter hemorrhages in fingernail, it is infective endocarditis. Retinal hemorrhage with pale center, rough spot. Okay, then is telangiectasias. Okay, you will have fragile vessels, recurrent epistaxis, skin discoloration, venous malformation, GI bleeding, hematuria. It is hereditary hemorrhagic telangiectasia. Even the word is describing everything. You will have telangiectasia, you will have hemorrhages. Okay, it is also called Osler-Weber-Rendall syndrome. Okay, you will have platypnea in this case, you will have orthodoxia. Okay, no, here you will have platypnea. Okay, when you will stand up, okay, so shortness of breath will worsen. That is different from the orthopnea in the case of heart failure. And polyuria, polydipsia, it can be seen in, you can say, primary polydipsia, diabetic insipidus, whose central or nephrogenic. Okay, in diabetic insipidus, okay, see urine osmolarity will decrease. Okay, because in diabetic insipidus, more water will go out. Okay, so what will happen? See, urine osmolarity will decrease. Okay, and serum osmolarity will increase. So that is the case of diabetes insipidus. Then is no lactation postpartum, absent menstruation, cold intolerance. That is Sheehan syndrome. She, remember, it is common in female. Han is hemorrhage. Okay, in severe postpartum hemorrhage, okay, you will have pituitary infarction. So she, remember, it is postpartum, it is female. Han is hemorrhage. In severe postpartum hemorrhage like abruptio placentae, okay, or placenta previa, in those bleeding or a severe case of postpartum hemorrhage, you can have pituitary infarction. So what will happen? Okay, you will have decreased hormones from pituitary. It decrease thyroid, decrease cortisol, okay, decrease your prolactin, all will decrease. Then is next is heat intolerance, weight loss, palpitation. This is hypothyroidism, increase T3 and T4. Cold intolerance, weight gain, and brittle hair. It is hypothyroidism. It is so easy. Okay. Cutaneous dermal edema due to deposition of mucopolysaccharides in connective tissue. It is mesoderma caused by hypothyroidism. Also, it is given in Grave disease. In grave disease, it is the hyperthyroidism. It will be in pretibial mesoderma is classic for grave disease. So a facial muscle spasm upon tapping, it is chopstick sign. It is sign of hypocalcemia. Carpal spasm upon inflation of BP curve, this is Trazu sign. It is also of hypocalcemia. In hypocalcemia, you will have hyperactivation of sodium channel. Okay, so you will have carbopetal spasm. So spasm will be given. Okay, so then is a rapid, deep, labored breathing and hyperventilation. This is called casmol, okay, respiration. It is given in diabetic ketoacidosis. Okay, normal breathing is like that, but in this case, it will be like that. Deep, rapid and deep. There is differential with them. So here is the differential rapid shallow breathing. Okay, rapid shallow breathing. This is a case of okay ILD, interstitial lung disease, rapid shallow breathing. Okay, and this is rapid deep breathing in the case of diabetic deep breathing. Okay, remember in this way, these are differential, important differential. Then you will also have kind stroke breathing. It will be like that, hyperventilation, okay, and then hypoventilation, then hyperventilation, then hypoventilation. It is kind stroke breathing. Okay, apnea, hyperapnea, okay, so it will oscillate. It is given in congestive heart failure, opioid. Okay, in those cases, you will have kind stroke breathing. Okay, so here I have given you three examples. Skin hyperpigmentation, okay, done. Orthostatic hypertension, fatigue, weakness, muscle aches, weight loss, GI disturbance. It is Addison disease. It is primary renal insufficiency. In primary renal insufficiency, you will have hyperpigmentation. Primary will pigment. You will have increased ACTH, you will have increased MSH. Then is shock. Okay. In secondary renal insufficiency, you will not have hyperpigmentation. Also, you will not have hypotension because secondary renal insufficiency will not cause aldosterone deficiency and it will also not cause increased ACTH. Then shock, altered mental status, vomiting, abdominal pain, weakness. Here, main point is shock. Other are same symptom. It is a renal crisis. It is same like that, but it is acute renal insufficiency. Here you will have shock finding, fatigue, weakness, AMS, vomiting. It is same as chronic. Here you will have shock like finding. Okay, so that is acute renal insufficiency. Okay, done. Then I'm sending another link. We'll start from next.